One, go. Hi guys, we've decided to load up a video of your mastery, which is going to be IV cannulation, and we want to have a look at a lot of the aspects of IV cannulation. So when I put a cannula in, I just make sure that I'll introduce myself to the patient. They can see my ID and all that sort of bizzo, and I'll discuss with my patient, what I'm going to be doing and what that involves. I like to put a tourniquet on and actually have a look at the patient's arm after we've established a bit of a rapport, and I do like to take an alcohol wipe with me and just give the place a clean. I don't think that you can be too clean when it comes to these procedures. All right, I don't mind putting on an IV tourniquet and leaving it there. It's okay to leave a tourniquet on for a while, as long as you can palpate the radial artery, and you can also do some circobs that are acceptable. The reason why I do like to keep the tourniquet on is that we're waiting for all that sort of arterial blood to turn venous blood and get engorged on the way back, so it's doing its job. There's a lot of handy hints that you can do to engorge the vein as well, like making sure that the patient's well hydrated, even dangling their arm down a little bit low and all that sort of stuff that I'm sure that we've gone over. And at the end of the day, this is a revision video. You've done IV cannulation. I know that you've got your own little systems in place, and I want you to work out what's best for you. And I'm just showing you the way I do it. Okay, so once I've actually established that, I will get my flush ready early. So again, practicing drawing up your flush. All this sort of stuff needs to be done really smooth. Putting on your tourniquet on the patient, like practice putting tourniquets on in class. If you're not good at putting tourniquets on and you're fumbling around, your patient's going to feel it, and they're going to lose confidence in you, and that's where they're going to ask you the questions that are really, really awkward for you guys. Like, have you done this before? How many times have you done this before? You're too old to be in med school. You're too young to be in med school, whatever. Okay, so drawing up the flush, remember, screw that in. Drawing it up, getting the flush checked, right? Ideally, you should be getting somebody to check the flush with you 3 times. I like to just screw that in to protect my syringe, all right? So now I've established where I'm going to be putting the cannula in. I'm going to go and grab my equipment. I just wanted to show you this really quickly, okay? There's different types of cannulas, and we've purchased different types of cannulas just so that you can get exposure to them. See these striations here? These striations here mean that the cannula has a valve, and they're really nice and they're really luxurious because the valve will stop blood from leaking back, and it's awesome. And this cannula doesn't have a valve there, so this cannula is going to leak a lot of blood everywhere, which means it's going to be a mess. And I want to use this cannula today, I think. So I've got my cannula cap ready, I've got my flush ready, and now I've got an IV starter pack. The IV starter packs actually tell you the contents inside them, and they're just a really, really clever sort of way of just prepping you, helping you prep for this procedure rather than making you grab a whole ton of things. I like to have a blue sheet available to just put my rubbish on. It's really important that you differentiate your clinical waste and making sure that you don't put just simple paper in a contaminated waste bin or any paper in a sharps bin. I don't know why some people are putting paper in sharps bin. Honestly, I feel like fighting you in the car park when I see the paper in the sharps bin. Don't do that, all right? Okay, so now that I'm sort of ready to go, what I'll do is I'll get everything ready on my dressing trolley just for the purposes of this demonstration. So I've touched my patient with these procedure gloves. They're grubby now. I'm gonna open up my pack. So remember when we did aseptic technique, it was being very careful about how to open up the pack and careful not to try to contaminate the interior contents of the pack. So you can touch the outside, don't touch the inside. I'm going to put my cannula in there. I'll put my cannula cap in there as well. This is my chlorhexidine swabs, my lollipop that I can clean the area with, and this is my sterile gloves. I'll open up my sterile gloves away from the patient. So I'm close to being ready for the procedure, so I'll go off and do a hand wash, okay? 3-minute hand wash or whatever the correct policy is in the area that you're working in. Once I've dried my hands, I'm gonna put my gloves on, okay? So the gloves are packed with the thumb like this. So when I approach my gloves, I'm gonna bring my thumb in just to try to find that thumb hole, making sure that I don't contaminate my hands. Spreading my thumb and finger apart, pulling it down. Don't fiddle with it, okay? This is the dangerous part of the procedure, so you might see us standing up and looking at any contamination, so we don't want to do this. So again, opening this up, spreading apart. Okay, I'm good to go. Now, just a handy hint, with my cannula cap, I like to just loosen the cannula cap cover. So it's going to screw in like that, all right? So I just like to loosen it. Okay, this drape here, I use the shiny side of the drape down and then the rough side of the drape up, so that the patient, any blood coming from the patient can, so that I get the patient to lift up your hand, sir, okay. And I've got a clean area to work in, okay. Okay, so then I'll start off the procedure with cleaning the area. My tourniquet is already on, okay. So now I've got my clean area and my dirty area. So I'm going to start from the center of where I want to put this cannula in. And I'm going to let that chlorhexidine alcohol solution do its job. Okay, while I'm waiting, I'll get my occlusive dressing ready. And I can access my Steri Strip. So this Steri Strip is just one Steri Strip, and you can get two. I'm a little bit of a fan of the two Steri Strips, but that's okay. They give you a gauze square to mop up any excess blood, and you've got your occlusive dressing here. And see how there's a bifurcation there? I'll talk about that in a moment. Okay, so cannula. Okay, so rotate the cannula so that the bevel, right, which is that little hole there, is facing upwards. So when you pierce the vein, the blood's going to shoot up. All right. So keeping still for me, madam, or sir, or whatever, I'm going to go in with my cannula. I'll feel a little bit of a pop. Okay. Get some flashback. Okay. Now, a lot of the time there'll be blood coming out of this. All right. I think that this is an empty cannula. So I've got my sharps container there. When you take this out, you can get a lot of blood that's flashing back. Okay, I don't know if you guys know this, but at the end of these cannulas, there's a temporary cap that you can put on until you get your cannula cap ready. Okay, so my cannula cap's here. I'm going to take my cannula cap, screw that in. I rarely use that actually, but I just wanted to show you that that's what it's for. It's probably one of those things that you didn't know. Okay, so I can flush. Okay. You don't have to use the full 10. And now we've got to dress the cannula site. So get rid of the excess blood, okay, because the excess blood is going to attract bacteria. Okay, so that Steri Strip doesn't go across the cannula because it's too fat, and it's really important that we see the entry site. Any signs of extravasation or any phlebitis is going to show up at the entry site. Okay, so the next step is to remove this dressing here. the border's there to give you the rigidity and the flexibility, okay? See where there's this little area that bifurcates? It accommodates the junction of where the IV cannula cap meets with the IV cannula. All right, take off the border. All right, so with the occlusive dressings, some of you may have actually seen my other video. The occlusive dressings are the adhesive on the occlusive dressings are activated by two things. One is pressure, and two is the warmth of the patient's skin. This is clearly not a warm patient, okay? But it's really important that you apply some pressure. Okay, there's a little sticker here that we can actually write down the date. I even like to write down the time. Okay, tourniquet comes off. Thank the patient. Clean up your mess. All right. I guess we can put this Steri Strip on. This Steri Strip goes underneath and seals that for you. Okay, so this is contaminated waste. This is the only contaminated waste. So I'll put this in the yellow contaminated waste bin. All this paper, put it on the normal bin. This is a trapdoor, okay? You think the procedure's over, it's not over. Disposal of your sharps is a really big part of this. This is a deal breaker. If you put the sharp in the wrong container, that's a deal breaker. You're gonna have to do your mastery again. Please don't get into the habit of taking the sharp implement out of your sharps container and dropping it in. It's designed to do this, to dispose of the sharp, okay? That goes in the contaminated waste bin, as would all of this. We're gonna ask you a series of questions. Those questions are gonna be based on the content that we went over when we did IV cannulation. It also might be applicable to think about the venipuncture CPS that we did all those weeks ago when life was a little bit more normal. So yeah, so that's the vid. Think about how you're going to prepare yourself, the consideration of right hand, left hand, or whatever, like your right hand, left hand, and I think that's it. So you can ask any questions. Yeah, I'm going to post it up on Clinical Skills with John, but I'm not going to make it a public video, so I'll make sure that our clinical staff will distribute the link to you. So it's not going to be a public video, but go on there and ask us some questions, and I'll make sure that we can answer them. All right, thanks guys. Have a good one.